Well, hello there. Come in, take a seat, please. I guess you're here for an eye exam. Well, that's why I'm here. Yeah. I believe these are getting more popular. Ever since I started offering the relaxed sort of ASMR eye exam, they've become very popular. So may I take your name, please? Oh, new pen. It's always got that little like thing on the top. There we go. Right, so your name. Okay, your date of birth, please. Okay, and that would make you not older than you look, may I say. Okay, and your current address, please. Ah, very local. Marvellous. And can we take a contact phone number, please? Okay, email address? That's certainly an interesting email address. A lot of people have multiple these days, don't they? I believe that's become a staple. I personally have one for work, one for personal, and then one for the random things in life. So, we'll firstly here, first and foremost, for an eye exam. So let me first take a look at those eyes. I thought the shirt doesn't have a top pocket in today. Yes, I'm pretty trained about a top pocket, but this is one of my nicer shirts. Long sleeve, bit cool today, you know. Yeah. So, I have to have everything down to the side of me. Okay. Oops. Put that on the floor. Right. Before we start properly, I'm just gonna new box of gloves. You don't believe how quickly we go through these. Go through them. And this time, I accidentally ordered the smaller size. I've had people say before it takes me a while to get gloves on. You would think, me having to put them on every day, I'd get rather quick. But especially when they're a lot smaller than I was expecting, they actually slip on rather quick. So now we're all ready. I'm going to just shimmy forward, and I'm just going to have a feel around your eyes, just around here. Is that okay? Should have asked before. Just want to make sure everything. Move feel around your eyes. Any pain at all? No, no pain. Some more of this. No pain at all on the eyes. Good. Okay, so no pain. Let me just saying, just face straight for me. I guess sit up straight. Yes. I'm just seeing if your eyes are. Look here for me. Okay. Look, just here. Look at my finger. Yes. Certainly is. Interesting. That's for sure. Certainly have an interesting set of eyes. I don't know if you can hear that, but I can hear the ice cream man sound making me a little bit peckish. But I digress. This is work. And work is not time for ice cream. Okay. So, we'll just have a quicker look, shall we? It does certainly seem rather strange. You always had the same colour eyes. Yes, you have. Okay. Just sitting here in this light, just to kind of gauge a certain sense of how your eyes adjust normally to the normal kind of light. Yes. Your eyes just adjusting normally is tell me quite a bit of information I need to know. So, what kind of TV shows do you like to watch? Just thought I'd make conversation while I'm waiting to see if there's any change. The pupil dilation seems fine. Oh, really? It's not a good show. Yeah. I've been told it's interesting. I should really give it a watch. Yeah. And, a guy in the other day, actually. Hey, he was looking for someone. Quite weird. Looked a little bit like me. Looking for, said a witch. I don't know. But said you could see a witch in the eyes. I don't know. Opticians. We get all the people in here. Alright. So, I don't see any drastic changes just normally. So we're going to go on to the old plushies. Okay. So, for the first test, all I'm going to get you to do is I'm going to get you to follow. Actually, we're not going to start with the lights. No, we're not going to start with the lights. We're not going to start with the lights. Let's start with the old trusty finger. Before lights were invented, all you had was a finger, so you had to follow the finger. And I still find that fingers, even when followed, actually still gave quite an interesting result. So, please follow this finger with both your eyes. Please do not move your head. Please just keep your head directly straightly at me. And I will get you to just follow that finger with your eyes. Okay, marvellous. So, we're going to start right here. Okay, hold it there for a sec. Okay, I'm just going to ask you to just cover this eye for me, and then, just hit myself on the face, as you do. And we're just going to test the other eye, just test on its own, because sometimes when you test both eyes, you can't see if one is particularly dominant or if one is kind of, I'm trying to think of the word, like helping the other one out. And usually if I can see them on their own, it can show if there's any damage to any particular eye. That's why you always get the rigmarole of doing both, then one, then the other. It's just so we can see in any particular test if one eye's doing marginally better than the other. Yeah, okay. So just close this eye for me. Marvelous. Okay, now follow the finger. Very good. Keep your head straight. Don't move your head. Okay, marvelous. Very good. Very good. Okay. Yep. Okay. You can take the hand away now. I'll just let your eyes adjust back to the way they were. Marvelous. Okay. So I'm going to do the exact same, but just going to cover this eye this time. Okay. Great. Okay. Cover the eye for me, and we will just do your follow finger. Please do not move your head. Marvelous. Marvelous. Okay, you can remove your hand now from that eye. Just see the eye readjust. Very good, very good. Okay, what I'm going to do now is I'm going to get you to look at the old schnoz. As people have got, it's weird actually. There's like a little thingy on the internet, and you can put comments, and someone always says that I mention the schnoz. It's crazy. Yeah, that's my word for nose. I like it, schnoz. The old schnoz. Okay, so what I'm going to do is I'm going to get you to look directly at the nose, this big nose, and then I am going to just bring my fingers in, and you're going to tell me when you can see them just by saying yes. Okay, see them there. No, just anything that tells me that you see them. Okay, you can even give me a thumbs up if you like. Okay, so at the nose. Very good. Marvelous. 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 Very good. Marvelous. Right. Marvelous. Good. Excellent. Spectacular. Fun-dabby-doozy. Fun-dabby-doozy. Okay, we're going to get you to cover this eye, and then we're going to do exactly the same again. Okay, so directly at me, just with that eye covered, and I'm just going to get you to tell me when you can see the finger. Okay, marvelous. Very good. 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 Okay, you can take the hand away. We'll let the eyes readjust, and we'll do exactly the same, but with the opposite eye, please. So whenever you're ready, just cover the eye and we'll start. Yep. Please look at the nose. Okay, ready? Good. Marvelous. 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 Very good. You have very fantastic peripheral vision. Good. 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 Okay, you can take your hand away. So for the next one, we're going to do something pretty similar. But what I'm going to get you to do is I only want you to do it when you see me wiggle my finger. So if you see it, doesn't matter. Don't want you to tell me. I only want you to tell me when I start to move it. Okay, like that. It will be like that. It'll be something you can see, obviously. I won't just go. It'll be something like that. Okay, very good. Right, so just straight at the nose, please. Very good. Very good. 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 Very good. Very good. Very good. Okay, now just cover this eye for me. And we'll just do exactly the same thing again. Okay, ready? Good. 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 Very good. Very good. Very good. Okay, you can take your hands away now. And we're just going to do the other eye. Sorry, it's a rigmarole. I know it can get quite exhausting, but we need to do all these specific tests to make sure that your eyes work perfectly. Okay, please at the nose, and we will go again. Okay, an eye. Only when it moves, remember. Only when it moves. Very good. 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 Okay, you can take your hand away now. And what I'm quickly just gonna do, with your permission, of course, I'm gonna just use this. It's a new little piece of equipment we like to do, and it just takes a like a very quick picture of the eye. It's just quick. It takes a very good picture of the eye, and I can see it. We don't have the big machines in places like this. This is more thingy, so we're getting these kind of like smaller test kit kind of things. Slowly but surely we'll get like the bigger things, but at the moment we're just using kind of the field test kind of things. So yeah. So with your permission, yeah. Okay. So good. Just checking that comes up properly, check that scanned correctly. Okay, I don't think it's scanned correctly. I'm just gonna take another. There we go. I'm just getting some data about your eye. Yeah. Okay, I'm gonna just do a picture of the other one. Okay, I kind of moved on that one, so I'm just going to take it again. Marvelous. Okay. Just takes a picture of your eyes together just to get them a general idea. What's the big antenna? Oh, that just helps measure. It's a measurement tool. A little remote for it. And it only has so much room, so they provided a remote that could have made it a little bit bigger. You know. Okay, that seems fine to me. So I'm just going to have another look at your eyes with the old magnifying glass. I'm going to see what we can see. Okay. Now we're going to transition to the lights. Now I've started using the lights a bit more. We're going to transition to using the lights and see how your eyes react more to the light. And then we're going to go from there. Okay. Marvelous. Okay, so first we're going to start off with the old, just normal flip light. Okay. So I just want you to follow the light, but please try not to move your head as much as possible. So just, the general, that kind of thing. So we're just going to go from there. Okay, so follow this light, please. Okay, so what you're going to do is just cover this eye for me, and then we're going to do the same thing again with just the separate eye. Yes, I know, I'm so sorry, this is very monotonous, but I need to do all these tests to make sure that your eyes work properly. Each test tells me something a little bit different about your eyes, and even just having the light tells me a lot of difference in your eyes, the way they work in certain light environments, and then the transition back also helps me to understand your eyes and the health of your eyes. So, yeah, you're doing absolutely marvellous. Please just keep what you're doing absolutely marvellous. Marvellous. Okay, just follow the light with your eye. Yeah. Just follow that light. Very good. Okay, I'm just going to actually take that hand away and we'll just do the other eye, please. Yes, very good, okay. Okay, very good. You take the hand away now. Please turn your eyes to my left, please. Apologise, I am slightly dyslexic, so my left and my right always do give me a little bit of trouble. Okay. And to the right. And up. And down for you, please. Marvellous. Just gonna let your eye readjust and then we'll do the same to the other eye. Yeah, I'm just checking. I'm actually looking at the very back of your eye. Okay, so to the left, please. To the right. Up. And down, please. Marvellous. Yeah, that one was reasonably healthy. Just going to switch to another one. That one is broken. Just going to use the scanning wand, as I call it. It shows me how your eyes react to certain types of light. Very good. Very good. Yeah, you're doing really well. Absolutely marvellous, I would say. Cover this eye for me. Just keep moving straight ahead for me. Okay, take the hand away and put on the other one, please. Marvellous. Okay. And again. Okay, let me take that hand away now. Right, so I'm going to go back to this one for a little bit. What I'm going to ask you to do is I'm going to ask you to do the same as we did before. I'm going to ask you to look at my nose, the old schnoz, and I'm going to get you to just say when you can see the light. So I'm just going to bring it in, shine it, and you will then tell me when you specifically see the light. Marvellous. Okay, so right here, please. Great. Marvellous. At the nose, please. Marvellous. 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 Okay, and cover this eye for me. I'm actually going to do another test in a second, and it's quite an interesting test to see the reaction. Okay. Yeah. Marvellous. Marvellous. Very good. Very good. Very good. Okay, take that hand away, and we're going to just quickly do the other eye. Okay, good. Marvellous. 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 Okay. Now what I'm going to get you to do, I want you to constantly look at my nose, but this time I want you to kind of, as soon as you see the light, I want your eyes to go from my nose to that light as quickly as possible. Okay, so as soon as you see the light, I want to see your eyes go. However your eyes react to that light, I want you to find that light as quickly as you can. I will see. You don't have to tell me this time, I will see. Okay, so start on the nose, and then each time we finish that one, go straight back to my nose, please. Okay? Good. 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 Very good. Marvellous. 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 Doing right well, marvellous. Marvellous. We had the electrodes on, and it'd be quite interesting to see how clearly your brain reacts to this. It's kind of brain-eye coordination. Your eyes need to then see the light, your brain needs to tell your eyes to move to that light. So there's always that like millisecond. Quite interesting the way the eyes and the brain work, how very quickly and usually fluidly it works. Okay, so we're just going to cover this eye. We're going to do exactly the same. So as soon as you see the light, I want your eye just to dot to it, please. Okay, marvellous. Very good. Very good. Marvellous. 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 Your scores will be fantastic, aren't they? Marvellous. Marvellous. Very good. Marvellous. Okay, so that hand away. We'll just switch to the other one. Yeah. Okay. Very good. Very good. Marvellous. Marvellous. Yeah, I don't know if you heard that. I think you can hear my cat. My cat likes to be in the office. She doesn't like to be alone that much. A little bit of separation anxiety, but I love her to bits. So, yeah. Marvellous. Marvellous. Very good. Marvellous. Marvellous. Yes, I have 3 cats. Love them to bits. Marvellous. Focus on the light, please. As soon as you see it, please get your eyes to it. Marvellous. Marvellous. Okay, you can tap that and take your hand away. Yes, I have 3 cats. Cara, Luna, and Lena. I love them to bits. Yes. Yes. They are little rascals sometimes, especially first thing in the morning, and they're like, wake up, I want your attention. And then all throughout the day, they're like, I do not want your attention. And as soon as you're about to go to sleep, it's, I want your attention again. Yes, cats are very demanding animals, but I love them. I love them to bits. They want things on their terms, which is quite an interesting thing to deal with, that's for sure. It's like having a small child, set them up furry, and they'll just scream at you. Like, it won't learn your language, it'll just go, give me what I need, but I'm not going to tell you what I need. Yeah, that kind of thing. Okay, so we're just going to move on. Oops. Oopsie daisy. 2 of the torches just dropped on the floor. That's not good. Okay, we're just going to move on to one of the bigger torches. Just gives me a little bit more to work with on the light front. Yeah. Okay, just follow the light for me. Follow this light. Very good. Very good. Okay, cover this eye for me. This one. Very good. Tell you what, dressed all in black, I look like I'm about to go and burgle someplace. Yeah. Okay, take your hand away and we'll cover the other one, please. Okay. Very good. It looks like I'm going to be a very high-class burglar. Shirt and tie and black gloves. Need the black pillowcase and I'm in. Very good. Yes, your eyes look. Just going to try this one. Oh, actually, this is a bit of a new one I don't think I've used. Oh. Don't seem to have. Actually, it's in this one. That's a shame. Oh, that is a shame. 1 second. It's a shame. Yes. The batteries seem fine. Ah, there we go. That's more like it. Oh, that's not good. It's not exactly the best torch I've ever had. So we'll just go with this for now. Okay, just gonna get you just to look to the left for me. Okay. Very good. And to the right. Very good. Up for me. Okay. And finally look down for me. Very good. This light helps me just manipulate where the light's going. Trying to see a little bit easier. Yeah. The bottom of it fell off. As it does. Rather strange. I have to get that fixed. I did like that one. I certainly did. This one makes weirder sounds. It's one of my brightest I have. Yes. Certainly lets me see certain things a bit clearly. Yeah, it's very small too. And boom, bright light. It's become more me showing off my torches than I like them, but you're looking at all my different pieces of equipment. Yeah, in a small town, opticians like this, we don't have the bigger 1 or 2 machines. We don't have all these fancy computers. We just have a bit of field tech, a few torches, and we see where we go. Crikey, those dogs, if you can hear them. If you can't, we're certainly have to get you in for a hearing exam as well. Ooh, these are a bit tight, that's for sure. Yes, I would say your exam is all done. Yes. Now, you do need to have regular exams. Book you back in about 3 to 6 months from now. Yes, I do want to, however, keep an eye on that. Your left, my right hand side eye. Yes, I do believe it will in future develop a little bit of a problem. I can't be sure without regular eye exams, so I'm going to just write down in my notes to keep an eye on that in 6 month time window. Yes. Okay. So I think we'll leave it there today. Crikey's at the time. Should be saying good evening and good night to you. It's getting rather late. I shouldn't have kept you this long. I apologise. Oh, you found it relaxing. Good. I'm certainly glad about that you found it relaxing. Yes. I'm trying to get it more around the surgery setting, more of the relaxing, especially during times like this. People need to be able to feel like they can relax and they're not anxious coming here to have their eyes checked, their ears checked, things like that checked, and their physicals and whatnot, and medical exams. Yes. So I feel the relaxing atmosphere can certainly help with that, need with that. Yes. Okay. Right. So we'll see you in a little while, and I hope you have a good rest of the day, rest of the evening, rest of the night, and I will see you in the future. Yes. Thank you. Good night to you too. Hope you have a very